Hello guys. Today we are going to discuss about a blood test laboratory investigation called cryoglobulins. Use of the test to determine if symptoms such as the sensitivity of extremities to cold are due to the presence of abnormal protein called cryoglobulin in the blood. When to get tested? When a person has symptoms such as a rash, bruising, pain, weakness, joint pain, or paleness and coolness of the extremities that occur at a cold temperature. This test detects and sometimes measures the relative quantity of a cryoglobulin in the blood. Cryoglobulin are circulating proteins, specifically immunoglobulins such as IgG, IgM, IgA, that clump together when they are exposed to cold and dissolve when warmed. They may be present in small quantities in blood of some healthy people but do not cause disease. In affected individuals, they are most frequently associated with abnormal protein production and numerous underlying disease conditions. Precipitated cryoglobulins can slow the flow of blood and block small blood vessels. The presence of a large amount of a cryoglobulin in the blood, called cryoglobulinemia, can cause symptoms such as bruising, rashes, joint pain, weakness, and Raynaud phenomenon, pain, paleness, blurring, numbness, tingling, and coldness in a fingers with exposure to cold. Cryoglobulins can cause tissue damage that lead to skin ulcers and in severe cases to gangrene. They can activate the immune system and cause inflammation, leading to damage to organs such as kidneys. Cryoglobulins may be seen with a variety of conditions, including infection, example hepatitis C, autoimmune disease, Sjogren syndrome, and cancers, multiple myeloma. Cryoglobulins are not specific for or diagnostic of any of these conditions, but are one of the signs associated with them. There are three types of cryoglobulins. Type 1, which consists of monoclonal immunoglobulin, a single type of protein that is produced by an abnormal clone of an immunoglobulin producing cell, B cell. This type can be seen in patients with myeloma or lymphoma. Type 2 consists of a mixture of a monoclonal and polyclonal immunoglobulins. This type can be seen in patients with hepatitis C or other viral infections. Type 3, which consists of polyclonal immunoglobulins, this type can be seen in patients with autoimmune diseases. Cryoglobulin testing involves collecting a blood sample into a pre-warmed tube and keeping the sample at body temperature during the test preparation. The person's serum is then refrigerated for at least 72 hours and examined for precipitate. After 72 hours, if precipitate is found to be present, then the quantity is estimated and the sample is warmed to determine whether the precipitate dissolves. If it does, then cryoglobulin are present. The initial testing does not distinguish between the three types of a cryoglobulin. Further testing, such as protein electrophoresis and immunofixation, quantification of immunoglobulins, complement, and rheumatoid factor can be done on the warmed sample. For accurate diagnosis, it is important that the type of a cryoglobulin is determined. Sample required is blood. Normally, cryoglobulin do not have a consensus reference range. Serum cryoglobulin in most individuals are in low concentration, 100 to 300 milligram per liter. That is about cryoglobulin.